So we were very excited that we wanted to start immediately. We wanted to have our teams in the schools, in the classes, educating and so on. But we had not foreseen challenges that we came across. The issues of stigma within the community was very high, which meant that parents were not accepting to the idea. It meant we had to do a lot of stakeholder engagement. We had to conduct a lot of parents meetings which were not successful. It was clear to parents that we were sort of not coming to help, but coming to promote that their children have sex. So the work then did not start with the learners. It had to start back in the community with parents. How do we then now engage with them? How do we raise awareness to them so that they are accepting to the idea and they allow their kids in the schools to access the services? So those were the challenges that we faced, and we sat down and we said, how do we do this now? Then we changed our strategy, because at first we had thought, okay, we'll just go to schools, do parents meetings, engage principals, engage the circuit management and start. When we engaged the circuit management, we had no problems. They were very accepting to the idea of promoting early testing amongst young people. But when we engaged parents, it was a different story. We then looked at what were the community opportunities that we can use. We went back to community events that were held. We went back to the community cadres that were working in the area to say, how do we pass on our message to the community health worker that does home visits, so that when they get to household, they promote. They talk about the importance of testing, especially for young people, and sort of make sure that parents understand and they are accepting to us testing their kids in the schools. Whenever we had community events like the Youth Day events, the Women's Day events, the STI and Condom Week events in the community, would always put in the message about the school-based testing and the importance of learners to test. And slowly, I think it kind of, they sort of started to understand why it's important to do HIV test early before you are sick, and why it would be important that we engage with the learners at an early age, so that it sort of becomes a norm. That's now and then I test for an HIV. Now and then I'm aware what's happening about my health. So parents started to slowly understand. We saw that by parents starting to request our door-to-door field workers to come into their homes and provide testing. So that's when we started to see that if a parent says, can you come in Friday afternoon, my kids will be there, I want everyone to get an opportunity. And that's when we saw that, okay, they are starting to accept.